right? A basic terminology in surgery. So this is what is known as debridement. So if somebody in surgery field is telling you that debridement, what does debridement mean? Okay, so debridement in surgery. Here I have a very beautiful picture, and let me just give you a simple story about debridement. Debridement just simply means cutting something off. I'm reducing the surface of something. So it's usually used in wounds. So you have a wound, and mostly maybe the wound is affecting the blood supply to that region. So over time, tissues are dying. If tissues are dying and you leave them on tissues that are alive, it will affect the healing rate of the tissues that are alive. So if you take off the dead tissues, it hastens what? The recovery rate in those tissues that are alive. Yes, that's just the click there. So debridement in surgery just refers to what? Medical removal of dead tissues, damaged tissues, or infected tissues, because you want to improve the healing potential and you want to reduce the risks of what? Infections. So it's a critical step in managing wounds, ulcers, and burns. So on the surgical site where what? Unhealthy tissue may prevent recovery. Yes, like I was telling you guys. So definition: surgical debridement is the process of excising non-viable tissues from the wound or surgical site. Very nice, So it creates a clean wound bedding that promotes healing. All right, reduces bacterial load, because those bacteria, they tend to actually even, they tend to grow more on tissues that are actually dead. Okay, they tend to grow more on tissues that are dead. So it will allow healing to regenerate. So common context is used in chronic wounds, all those diabetic foot ulcers, traumatic injuries, and burns. You understand? You just scrape it up. Okay. So types of debridement: we have the sharp or surgical debridement using all those scalpels, scissors, curettes. We have the mechanical debridement, which is physical removal. Okay, such as irrigation of wet to dry dressings. Have the autolytic debridement, which are using the body's own enzymes and moisture to break down the dead tissues. Then we have the enzymatic debridement, which is application of what? Topical agents that dissolve necrotic tissues. Then biological debridement, you are using sterile maggots. Yes, some maggots could be grown in a lab and they are now used in tissues, in wounds. So they now eat the wound, eat the dead tissues off. So indications: if you have necrotic tissues or swellings in wounds, infected wounds where the bacteria thrive in dead tissue, chronic ulcers, okay, burns or traumatic injuries, okay, with deep vitalized tissues. So that's what we got. Benefits is reduce the risks of infections, stimulates healing, improves effectiveness of antibiotics. So if I'm actually coming in to take away the dead tissues that cause a lot of issues there, of course, if I give treatment, the treatment should be much more, functional or much more effective. So prepares wound bed for grafts or reconstruction surgeries. So that's it for debridement.